If you're considering starting a ketogenic diet to treat mental illness or psychiatric symptoms, you may want to prepare ahead of time with tips to make it easier. In today's video, we'll go over the pro tips from the experts who've been there and have worked in the field for decades to help you set yourself up for long-term success with maintaining a nutritional ketosis program. We'll hear their top tips and what they see as the most significant challenges, and talk about the timing of starting nutritional interventions, and even get into the responses when someone says the diet is too challenging or too restrictive. I love some of those answers, so I hope you'll find them helpful. But first, welcome back to Metabolic Mind, where we're working to revolutionize the treatment of mental illness by providing information and resources at the intersection of metabolic health and mental health. I'm Dr. Bret Scher. Metabolic Mind is a nonprofit started by Roblox founder David Baszucki and his wife Jan after their son Matt sent his psychiatric symptoms into remission with a metabolic intervention, nutritional ketosis. Our goal is to help families like theirs learn about this new approach to treating mental disorders and to offer a message of hope that freedom from the burden of mental illness is possible. Now, if you haven't already, I encourage you to watch our prior video where we go over the 4 main areas of concern when treating mental illness with a ketogenic diet. As a quick review, those 4 main concerns are the keto flu, changes in medication levels, sleep alterations, and changes in energy. And that's why working with an experienced professional is so important. Now also, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or your medications. Therapeutic nutritional ketosis, or simply starting a ketogenic diet, is a powerful health and medical intervention that can change your body's metabolism and can dramatically alter brain function, medication levels, sleep patterns, energy levels, and other physiologic functions. If you have a psychiatric diagnosis or symptoms or take psychiatric medications, you should not start a keto diet alone. But now, let's get into the tips that can help make starting a keto diet easier. The first is how quickly you transition into a ketogenic diet. Let's hear from Harvard-trained psychiatrist and metabolic psychiatry pioneer, Dr. Georgia Ede.
Well, I've gradually learned over time that it is, for most people, much more comfortable and much more practical to go a little bit more slowly. And for a lot of different reasons, but particularly when people are taking certain medications that affect, say, for example, blood pressure or blood sugar, because blood pressure and blood sugar can change very quickly in the very first few days of a ketogenic diet in particular. And so if you have an existing health problem, and if you take certain types of medications, plunging yourself in from let's say a standard diet with hundreds of grams of refined carbohydrate in it to a squeaky clean ketogenic diet, that's a huge shock physiologically to the brain and to the body, and you'll put yourself through unnecessary misery if you do that. What's the hurry? So if you go a little bit more slowly, it'll be a lot more comfortable. And so I think for that reason, now there are some people who want to do it more quickly, and for some people there's no reason why they can't. But I think if I don't know you, my recommendation would be to say ease into it. And that way, because you want to set yourself up for success. You want to be able to experience what's on the other side, what's waiting for you on the other side. And if you don't get there, you're not going to be able to experience all of the wonderful things that are possible. So why not ease yourself in? And practice simpler strategies first, and over a course of several weeks, work your way towards ketosis.
So this goes back to one of the main concerns when starting a keto diet, the keto flu. But by regulating the pace of starting nutritional ketosis, you may be able to avoid or reduce keto flu symptoms. So next we'll hear from Beth Zupec-Kania, a registered dietitian with over 30 years of experience using ketogenic diets for epilepsy and mental health. These are her top tips for getting started with a keto diet.
Well, I think my first advice to anybody that's considering keto is to first pause and not consider what they're going to take in as a diet, but think of it differently. Think of it as a lifestyle. And when you reframe it like that, that you are going to be taking on a lifestyle that can change your body's metabolism, improve your brain function, then people kind of give it a little bit more respect and treat it a little bit more seriously. And we often talk about, again, diet with ketogenic, but ketogenic lifestyle includes some kind of activity or exercise, if we can use that word, because that really improves brain function for one, but also your ability to stick with a diet when you feel better, when you're getting regular activity and regular exercise. So that's part of that lifestyle that we talk about. So that's my approach, is just to stop talking about it as a diet, but talking about, we're going to change your life. You are going to change your life. I'm going to walk you through those steps. And I assure you, you're going to feel better, because everybody does. Everyone tells me, I feel better. They might not get to their goal of improvement, but they always tell me that they feel better, whether they just wake up with a little more energy in the morning, or they're able to reduce their medication a bit or a lot. Everyone tells me, when we do this approach and go gradually and learn over time and not jump into it, but understand you have to be patient with yourself and adjust some of these bad habits into new ones, people feel better. They really, really do. I cannot believe, this is why I've stuck with this for so long, because people see results with this therapy.
That's such an important point. It's a lifestyle, not a diet. And lifestyle changes aren't just about nutrition, right? Well, so we'll hear about what experts feel are other essential lifestyle interventions later in this video. But next, let's hear from Matt Baszucki, who used a keto diet as a core treatment for his severe bipolar 1 disorder.
I would say adhere for a while to see if it works, because if it works profoundly well, that will give you the motivation to keep adhering to the diet if it works incredibly well. I got the food prepared. That's important. I think it's important to make sure the food is ready, whatever that looks like, cooking or preparing the food. Always to have access to like some high fat snacks. You just got to want it. It's such a tricky thing, learning how to eat out on keto, tracking the ketones. I tracked my ketones every day for many months when I first went on the diet, which was helpful just to keep me on track. Don't forget the electrolytes, and hopefully work with a dietitian along with a psychiatrist who knows what's going on, and then dig in. Like I sort of like, I'm almost a meme in my friend group at this point, because I've been doing this almost 2 years. But the way I did it was I leaned into it. Like, this is almost part of my identity now, and I'm fine with that. And I did not cheat. Like, that's important. It's important not to cheat. This is one thing. Like, it has to be thought of as a treatment, the same way a medication, where you can't just skip a couple days of psychiatric medication. Bad things happen. In the same way, you can't just have ice cream. It's like you commit for 30 days, 90 days, I don't know, but it has to be a full on 100% commitment. That was for me, and so rewarding. Like, it's not only rewarding from the standpoint of I have stable mental health, but just knowing that I'm doing something that's going to be good for my metabolic health in the long term, and all of the different diseases and illnesses that we're starting to think, this is linked to. Like, that's really rewarding. That's a huge part of it. Get sleep, work out, eat keto, have good skin, good cardiovascular health. Like, that just, it's good for your self-esteem, man. I'm convinced. Anyway, that's all I got.
Again, those are such important points. Food preparation, having snacks available, not getting caught off guard. But I also really appreciate how he sees a ketogenic intervention as not a diet. It's even more than a lifestyle. For Matt, it's a medical prescription. And as one of Matt's doctors, Dr. Chris Palmer, says, it's a serious treatment for a serious disorder and deserves to be seen as such. Next, licensed mental health counselor Nicole Laurent gives her top tips for success.
To answer that question, it depends a little bit on the level of functioning that the person is at when they begin their ketogenic diet. So some people are functioning a little bit better and preparing ahead of time behaviorally, looking at meal plans, figuring out your top 7 recipes that you're going to go through the week in order to meal prep and maintain your ketogenic diet. For some people, that is really simple. And for other people, they're not functioning very well. And so sometimes the behavioral piece that we need to do is we need to talk about what would meal delivery service look like for you for the first few weeks in order to just ensure that you're going to be able to take care of yourself and be able to learn this new way of eating. Because some people, they're really understandably, they're very overwhelmed. They're not functioning very well. That's part of why they're coming to us. So making sure that they understand that we're not going to stop progress for perfection. So I can't do it perfectly. I can't do it exactly the way it's supposed to be done. Maybe these first few weeks, I'm not functioning well enough. I can't do it. Well, here's some things that we can do with that. Here's how we make it super easy so that you can get started. And then as you start to feel better, you will find that you are in a different place to start new behavioral strategies in order to move forward with the diet.
Again, we hear the importance of advanced preparation. We just can't say that enough. But how about that quote? Don't pause progress for perfection. I love that wisdom. But knowing the tips for success also means recognizing the most common challenges. So here's Beth Zupec-Kania again with the most common challenges she sees when starting a ketogenic diet.
Yeah, there can be several challenges. And one of them is that other people try to sabotage this new lifestyle change for them by not being supportive, for one. Saying, why don't you just have a little bit of this ice cream? It's not going to hurt you. That happened with children with epilepsy as well. And unfortunately, family members outside of mom or dad were offending this rule all the time by feeling sorry for the child and trying to sneak things to them. So we got to warn people about the saboteurs, well-meaning family and friends. And then another challenge is setting up your environment in a different way. So looking at things, again, in a different framework. Are you going to go to a refrigerator and have the same things in your refrigerator all the time? Or are we going to clean this out and put things in there that are really good for you? So setting up the environment. Also the same for lifestyle changes in terms of activity and exercise. What are you going to do? Are you going to start taking walks every day, even when it's cold out like it is now? And knowing that you can do that and finding somebody that will go with you on a walk, or finding an animal that can go with you on your walk. I walk my neighbor's dog sometimes just to get myself out. But those little lifestyle changes are huge in terms of moving forward to making, a different life plan.
It's so essential to control your environment, to control your surroundings. Remember, you're not an island, and influences are all around you. Now, another interesting question, though, is when to begin nutritional interventions for mental illness. You can imagine there may be times when someone isn't receptive to changing their diet. But as Matt Baszucki says, anytime someone has support and they think they can stick to a diet, that's the right time. But the support part is so key. Let's hear from Matt.
I think anytime that the person is able to adhere, probably important, because going in and out can be difficult for a lot of people. And anytime that the person in question can receive proper supervision during the transition period, the first few weeks in ketosis. When I went on the diet January 3rd of 2021, Dr. Palmer was monitoring me carefully, and we had people, and I was watching to make sure that I didn't have any manic symptoms during the onset when I started dropping all these carbs out of my diet. So I don't know if there is a wrong or right time. I mean, I personally believe that if a person is symptomatic and is treatment resistant, or even just started this, there's no reason not to try it if the person in question is willing to comply with the diet. It's been so remarkable, and I've heard anecdotally, even though we don't really have the like real studies yet, but anecdotally about this has worked for like hundreds of people, and I would the last thing I would add is hopefully with under the care of a dietitian and a psychiatrist where everyone's on the same page, ideally, which is how I did it. So I remember having big meetings with my parents, with Dr. Palmer, with my main psychiatrist, and with a dietitian. And we were all kind of, figuring out what was going to happen. And we were all on the same page, which was the important thing.
And speaking of family support, let's hear again from Harvard psychiatrist and metabolic psychiatry pioneer, Dr. Chris Palmer, about the importance of family, the importance of clinician support, and how he responds when someone says the diet is too difficult or restrictive.
I think one of the biggest issues is the one that is the issue of family and clinician support. That if the patient has support from both family members or friends and all clinicians, so this means not just the mental health clinician or two, because sometimes people are seeing a psychiatrist for medications and a psychotherapist, but they're also seeing a primary care doctor. And if one or more of those clinicians is downplaying the diet or is saying this diet is dangerous and risky, that sows doubt for understandable and obvious reasons. And then patients become more tentative about the intervention. They become more afraid. And then if anything goes wrong along the way, if they experience any side effects or adverse effects, or just even have one or two bad days, they assume that that other person was correct, the diet is dangerous, and they stop it. Likewise, if people in the home are eating highly palatable foods that the person craves right in front of them, it's very difficult to get started on a diet when other people are eating your favorite foods right in front of you. So I think those are some of the situations that I've seen. I do want to just comment because a lot of people do say nobody can do a ketogenic or nobody can do a weight loss diet across the board. One of the interesting things is I'm getting patients with bipolar disorder, schizophrenia, and other chronic debilitating, disabling disorders to do these diets and stick with them. And I think far too often we give up on people. We shortchange them in terms of what they're really capable of. We underestimate their determination. And the patients that I'm dealing with are almost across the board desperate. They are desperate to improve their lives, and they will do anything to get better. And so if they are given effective advice that helps them do this intervention, they almost universally will give it a good shot. And many of them are highly successful at doing it.
We underestimate their determination. Such a great quote. And Denise Potter has a similar response when someone says a keto diet is too challenging or restrictive as well. So let's hear from her.
It can be really hard. So I'm going to acknowledge that it's not easy, but it really depends on someone's motivation. It's really hard to take chemotherapy, but when people have cancer, they do chemotherapy, right? I mean, that's maybe an extreme thing, but we do extreme things when we're in, having health problems. And so the higher the need, the higher the motivation, and the more we're willing to do things. And then sometimes I'll get frustrated because, let's say in a case of epilepsy or some type of situation where someone will say, oh, they won't be able to do it. That's too hard. That child won't eat that. And I'm like, who are we to say what they'll do? I've seen, these parents, discount a parent that wants to help their child get well. And so I think it's really unfair. So I think it's also unfair in the psychiatric community to just say, they'll never do it. It's too hard. Like, I've been hearing this about epilepsy for years, and that's not right. And it's not fair for clinicians to make that judgment about their patients of what they can do and can't do, or are willing to do and aren't willing to do, especially without even asking them. So yeah, get me started.
How we frame this discussion is so important, right? It's not a diet. It's a lifestyle, and even more, it's a medical prescription for a lifestyle. And that lifestyle prescription isn't only about nutrition. So again, let's hear from Dr. Chris Palmer about what he sees as the other essential lifestyle interventions.
I think diet is a huge factor. So interventions like low carbohydrate, ketogenic diets are obvious, but for other people, it can just be eliminating sugar or junk food. So diet is important. Exercise is important. Sleep and sleep regulation. And probably the fourth thing that I would highlight is eliminating substances that are toxic to your metabolism. And some of those are obvious to most people. Heavy use of alcohol is a metabolic toxin. Smoking and vaping are metabolic toxins. Marijuana is a metabolic toxin. So eliminating those substances, or at least reducing their use, is critically important. And most people would consider those lifestyle interventions.
And Nicole Laurent agrees with Dr. Palmer's emphasis on exercise and sleep, but she adds one more crucial factor. Let's hear from Nicole.
So there's a lot of different factors. So sleep is huge, helping people have good sleep hygiene and prioritizing sleep and understanding that they actually need to prioritize that for their brain to work well. As people get more energy on a ketogenic diet, I encourage them to start exercise. And a lot of people do, sometimes for the very first time, because they feel able to do that, which is exciting. Some of the other things that I tell them to do is go out and be social, because humans need other humans. And so for some people who have been depressed for a very long time or had social anxiety disorder, getting them to do the behavioral things that they used to avoid because of their anxiety or their depression is a big piece of the therapy work that I do.
Social interactions. Social interactions can be so impactful for mental health, and I'm really glad she mentioned it. Now, the last point I want to discuss in this video is the importance of circadian rhythms, which goes beyond just your sleep-wake schedule. It also involves your eating schedules. So let's hear from Argentinian psychiatrist Dr. Ignacio Cuaranta on how he uses a focus on circadian rhythms to help his patients.
We all know that traditional circadian medicine research has mostly focused on this sleep-wake cycle and how we manage dark and light cycles in our everyday life. But for the last 40 to 50 years, there's been an insistence in eating every few hours, having wide eating windows beginning at 7 a.m. and finishing eating our last bite close to midnight sometimes. As time passes, more and more research gets in regards to how food also acts as a signal giver for most of the cells of our body in regards to help reinforce healthier circadian rhythms. So in some patients that they have this disrupted circadian rhythm and maybe their sleep quality is not good, I found that trying to alleviate some of the dogmatic eating patterns that we are seeing among our patients, eating every 2 or 3 hours, which is possible only when you eat a high carb diet. Because when you eat a real food diet with a very nutritious diet, you start automatically spacing your eating opportunities. This by itself helps patients improve both their sleeping patterns and their eating patterns. And they are both highly prepotent, biologically speaking, in help them regain metabolic health. So this is kind of like the structure that I work with them, and it's helping me work with that circadian structure a lot.
Now, those are all fantastic expert tips for starting a ketogenic diet for mental health. I find them so helpful. But remember, the most important thing is working with your doctor in a controlled and safe environment. But now, what if your doctor isn't aware of nutritional ketosis, and what do you do then? I encourage you to watch our prior video about how to talk to your doctor and how to predict your doctor's concerns with a ketogenic intervention. It's a potentially very important video to help you safely start your keto journey. And as always, if you found this video helpful, please click the thumbs up and subscribe buttons, and make sure to share this video with your family and friends and healthcare providers so you can help spread our message to help as many people as possible. And also, please leave a comment. We'd love to interact with you and hear what you found most helpful. So thank you so much for watching. Please take care of yourself, take care of others, and we'll see you here again next time at Metabolic Mind.